session that we're doing. So it's basically your chance to contact us, ask any question you like about animals, anything vet related. So whether it's about wanting to know how to vaccinate a puppy properly, through to if you just want to know about life as a vet, feel free to ask us any questions. Today what I wanted to talk about is talking about lymphoma, which is one of the more common cancers that we encounter in vet practice. Reason why I kind of think this is quite a good one to talk about, it's a common one we get. Without treatment, it's pretty devastating disease, but with treatment we can actually get some very good responses. And I think there's a lot of misinformation out there in terms of what can be done in a sort of vet practice, and also what should be done as well, because I think that's always something we have to really look at, is what we should be doing for these animals. It's not about keeping them alive at all costs. It's really about giving them quality of life for as long as we can. So lymphoma, it's basically a tumour of the round cell types, and what we tend to find, the most common presentation we get for lymphoma, and I'm going to talk about lymphoma specifically in dogs, because cats it's a bit of a different story, but in dogs, lymphoma is the most common one we see is what we call multicentric lymphoma. So it's affecting the lymph nodes is where we really find it. And so the common lymph nodes that people notice are in under the neck, what we call the submandibular lymph nodes, and people will quite often come in saying, it feels like my dog's got golf balls or cricket balls even under its neck. And that's a really common sort of thing for people to come in for. Now, associated with that, some of these dogs can be unwell, some can be quite healthy and appear normal other than these large lymph nodes. But that degree of sort of lymph node enlargement is quite characteristic of lymphoma. Now, to confirm the diagnosis, what we normally do is we normally start off with what we call a fine needle aspirate. So we basically pop a needle into the lymph nodes and take some cells out just using the needle, put them onto a slide. We have a look at them in-house, and we're reasonably good at telling if it's lymphoma or not, but because it is such a serious disease and the treatment is so specific, we send them away to a pathologist to get confirmation. Now, normally from a fine needle aspirate, the pathologist can have a very high level of suspicion, but really to confirm it, biopsy is quite often what's needed. I mean, any diagnosis needs to be coupled with the clinical sign. So if we get very, very large lymph nodes, a fine needle aspirate that's suggestive of lymphoma, that is generally enough for us to say, look, it's lymphoma, we can start treatment on it. But extra information can be gained from doing a biopsy of the lymph nodes. We also look at doing blood tests, because we can actually learn a lot from the blood tests, both in terms of how the disease might be progressing, but also there's some prognostic factors that come from blood tests. And we may look at doing a bone marrow aspirate, because what we look at with the blood tests, the first thing we really look at is we look at some cell counts and see what they're doing. Now, if a lot of those cell counts are below where they should be, that might signify that we've got lymphoma in the bone marrow, and the bone marrow can basically get displaced with this abnormal cancerous tissue. So instead of being able to produce new blood cells as it should do, it's just got cancer cells in the way, so it can't produce as many red blood cells, white blood cells as it should. So we end up with a situation where we need to know about that, because the treatment is kind of going to be affected by how much bone marrow involvement we've got. So we may look at doing that depending on what the blood tests tell us. When it comes to prognosis, I mean, without any sort of treatment, lymphoma, the dogs don't tend to live very long. It really is a matter of days to weeks from diagnosis to euthanasia, or the animal passing away on its own. And so when we kind of start to look at treatment, we start to look at what we think the chances of the animal responding to treatment are, and also the duration of response. So there's a few things that we look at to see if they're, I guess, if you'd consider them a really good candidate for treatment. But even if these things are going against the dog, that still doesn't exclude them as a treatment candidate. It just means that we might not get such a great response. So something we can tell, and this is where doing a biopsy can be really useful, is we look at the type of lymphoma it is we get two types of lymphocytes. We get B cell and T cell lymphocytes, and that tends to carry a slightly different prognosis. So the B cell lymphoma tends to have a better or longer duration of remission than a T cell lymphoma, and slightly more responsive to chemotherapy as well. So it's nice to know that. At this point, it doesn't appear that our treatment options change greatly depending on whether it's B cell or T cell, but I think over the next couple of years we probably will find that our treatment options will change depending on the cell type, and that's going to lead to more sort of importance on working this out. We also look at what we call substage. So we look at how the animal is in itself and whether it's effectively well or unwell. So these dogs that come in with the very large lymph nodes but are otherwise well in themselves, they have a much better outlook than dogs that come in quite unwell. And unwell can be anything from being quite just flat and kind of looking like a sick dog, through to having disturbances in their calcium levels in their blood, which can then cause kidney failure and other associated problems. A study came out recently as well that indicated that we might be able to get some prognostic information from the blood tests. So what we look at is we look at the neutrophil and the monocyte counts, and if they're below a certain level, that tends to actually come with a better prognosis. There's a few different theories as to why that occurs. But that's something that we can get a little bit more information from. Now, I think the thing to remember with these prognostic factors is even if they've got really good prognostic indicators, it doesn't mean they're going to respond brilliantly to treatment. If they've got really bad prognostic indicators, it doesn't mean that they're not a good treatment candidate. There very much is an individual response to these things, and they kind of I mean, at the moment we really don't have that ability to say this dog will respond to this treatment for this long. But that's probably the future of cancer treatment. And where I can see cancer treatment going longer term is for us to test the tumour and test that tumour's responsiveness to particular drugs, almost the same as we do a culture and sensitivity for bacteria. So at the moment, if we've got a bacterial infection, we can send it off to swap off to the lab. They'll grow the bacteria and then work out which antibiotics are going to kill the bacteria. I think one day we'll get to that same stage or same sort of test with cancer, where we can work out which drugs are going to be most effective. At this point, we're not at that point, so we can't really say, look, in this case, this is going to respond for this long. All we can really do is talk about the odds, I guess, of getting a response and the duration of response. Now, what we talk about with response times is we talk about, I mean, probably the most important thing that people see is the median survival time. So when we talk about median survival time, we're talking about the time where 50% of animals are still alive and 50% of animals have passed away as a result of the lymphoma. So it gives us a fair idea, because there are some animals that won't respond at all and they'll pass away very quickly, and that might skew the average. If we just look at purely the average numbers, it might skew it down to a lower number, or we might get some animals that live for 10 years, and that kind of would skew things the other direction. So if we look at the median survival time, we can say, look, around half dogs are going to make it past this time, the other half aren't going to make it, but most will make it to more or less kind of where that median survival time is, almost like a bit of a bell curve. Now, with our treatments, what we really want to always get across is what we're aiming for with lymphoma treatment is not a cure. I mean, there are reports of cures, and I had one dog which lived for 4 years and was euthanized for arthritis. But that's not what we're aiming for, because to really get a cure for lymphoma, we'd need to be using very aggressive chemotherapy, and that would come with problems with needing bone marrow transplants, but also it comes with some fairly major ethical concerns in terms of you'd make the animal quite unwell while you're undertaking these treatments. And so to my mind, it's not about, like I say, it's not about keeping an animal alive at all costs. It's about having an animal that seems well in itself. And what I really aim for, and what I tell people I want with these lymphoma cases, is I want people who know these dogs to be able to come around and visit the family, and they shouldn't know the dog's got lymphoma, and they shouldn't know the dog's having chemotherapy. That's how healthy these dogs should be looking, and that's really what we expect for most cases. There are the occasional cases that are going to have side effects, and in those cases we have to either treat the side effects or modify our protocols, but we can do a lot to sort of keep animals really good quality of life. So like I say, we're all about quality of life. Quantity comes from that quality, but it's not about quantity at all costs. I'm never going to go through with treatment if I don't think it's in the animal's best interest. And I've certainly had to tell clients before, look, I don't think we should be carrying on with the treatment here. So when it comes to working out the treatment that's most effective, it really comes down to a few different things, and there's no right or wrong answer. There's no cookie cutter approach for cancer treatment, because what would suit one client and one animal isn't necessarily going to suit another client or another animal. And things that we have to look at, there's the obvious one of cost. Some of these treatments are going to be very expensive. There's other things like time commitment. So some treatments will need very regular visits into the clinic, so either weekly or fortnightly, and some of these treatments go for up to 25 weeks or even beyond, depending on which treatment option we're using and how the dog responds. So some people can commit that time to getting in and seeing us, other people can't. there's also just the overall health of the dog, whether there's other issues that are going on, because there's not a lot of point in aiming for a really long remission time if we've got a dog with severe arthritis or severe heart disease, which is likely to only carry a 6-month survival time anyway. So all those things need to be taken into account before we sort of work out a protocol. There are some rough protocols that we base our treatment around, but these quite often are modified. And so when we talk about costs and things, we talk about sort of an average cost, and if things go well, cost. But the understanding is that if things go wrong, so things that can go wrong, I mean, we need to have some animals that are a bit too boisterous, so we have to sedate them to give the treatment, just because these drugs are quite nasty. You have to make sure they go right into the vein and none are spilled. I've never had a problem with the dog being aggressive. Dogs, because we make it a positive experience in here, they're always given chicken and treats and absolutely spoiled rotten and padded by the nurses and taken for lots of walks. The dogs are actually very happy to come in and have their treatment, but sometimes they're a bit too happy and bouncing off the walls, and we just need to slow them down. So a bit of sedation can add costs. We get the occasional dog which will vomit, and so, I mean, we probably look at around or less than 10% of dogs having significant side effects with these protocols. And so the side effects we can have, vomiting is one obvious one. They can get diarrhea or other gut upsets. Hair loss is uncommon, but it can happen. Our most dangerous side effect can be if we wipe out too much of the bone marrow, because chemotherapy basically works by wiping out fast replicating cells. So we have that in the gut and the bone marrow as well as in the cancers. So that's why we can get some gut problems if we wipe out the fast replicating cells in the gut or bone marrow. We can wipe those out, and we can get a reduced production of white cells in particular, and that can lead to infection. So we can get serious infections which need treating very aggressively. So that's the sort of things that can alter our final cost. And sometimes it does result in you saying, look, kind of, this animal's got very unwell from this treatment, we're going to stop and just enjoy the time we've got left with them, or say, look, kind of their quality of life just isn't there. Now is the time for us to stop everything. So when I mention cost, it really is a sort of a rough cost, but it's something for you to sort of base ideas on. Now, the most common protocol that we use, it's something called a CHOP protocol, which was developed over in America, and it's a combination of 4 different drugs. So what we basically look at doing is we start off with weekly treatments for that protocol. So it's a combination of vincristine, doxorubicin, and cyclophosphamide and prednisolone. And we start off with oral prednisolone on a daily basis, and we give the other drugs initially on a weekly basis, and then we go out to fortnightly. That protocol takes about 25 weeks. It's a very, very good protocol. So about 93% of dogs are going to respond to it. And the median survival time is around 13 months. Now, this is where we do look a little bit at our prognostic indicators, because we would potentially say, look, this dog is a well dog. It's got these indicators on its cell counts. It's got a B-cell lymphoma, so that's possibly going to be more than 13 months. Whereas a dog that's unwell on presentation and might have a few other negative prognostic indicators, we might say, look, this is probably only going to be between 7 and 9 months if we get a good response. But like I say, we can't tell with individual dog and how it's going to respond necessarily. So we give that as sort of our rough sort of guide. Like I say, I've had some dogs which have gone very, very well. Other dogs, we haven't even finished the protocol before we've had to say, look, it's time to stop for them. So that protocol generally works out around $4,500 to $5,000 for the complete protocol. It's like I say, it is probably the most expensive protocol that we generally use here. There's a few variations of it that we can look at doing if the dog's not responding to treatment, or if we get some complications, we might tweak it slightly, but that's sort of a rough ballpark for that one. Very well tolerated. Like I say, 93% response rate. Less than 10% of dogs should be getting any significant side effects. And so really the consistent thing we get is people kind of bringing their dogs back in for their treatment saying, oh, it's like it's a normal dog. There's no issues going on there. And that's really what we aim for. Now, there is another protocol we can use, which is very similar to the CHOP protocol. We call it the COP protocol. So that's using the vincristine, the cyclophosphamide, and the prednisolone, not using the doxorubicin. Now, that can have some advantages in it. It's a bit cheaper short term, but the median survival time is only around 7 months. And if the dog keeps on going well, we keep on going with that protocol. And so the cost of it can actually, if the dog was to live long enough, would exceed the cost of the CHOP protocol. And it's an ongoing one. At least with the CHOP protocol, we get to 25 weeks, and then we can actually stop treatment until the dog kind of comes out of remission, and we have to kind of deal with it again. So it's nice to be able to get that sort of end point, I guess, with the dogs, where you can say, look, off you go home. You've got 6 months plus of not having to come and see me again. The CHOP protocol, it's constant treatment. So I tend not to use that one a lot. My second choice, if we can't do CHOP protocol, and that can be because of cost or because of the time commitment, they're really the 2 big issues, is to just use a drug called doxorubicin on its own. And that can be quite an effective sort of drug. So some dogs will go into remission after the first dose. Some dogs take several doses. And depending on how long it takes the dog to go into remission, we'll give between 3 and 5 cycles of doxorubicin. So cost-wise, it's probably $500 to $600 per dose. So if the dog goes into remission at the first dose, then we're maybe looking at up to about $1,800 for the course, because we'll give 3 doses. If it doesn't go into full remission with the first dose, then we give 5 doses in total. So that will get it up a bit more, kind of around the $2,500 sort of ballpark. But like I say, that's a pretty good one in terms of it's just every 3 weeks. It's a bit cheaper than the CHOP protocol. Once again, though, the survival time is really in the 7 to 9 months sort of ballpark, so not as long lasting as the CHOP protocol. There is an oral product that we do get the occasional client who doesn't want their dog to be getting injections. It's a drug called lomustine, and that can be used in combination with other drugs such as cyclophosphamide. That can be quite an effective drug. It's probably one of our better drugs when it comes to the T-cell lymphomas, and I think that's where we might see a change in the future, is incorporating lomustine into the treatment of T-cell lymphomas. And there are some tumour locations where we have a high suspicion of T-cell lymphoma, so we may actually use that as a primary drug in some cases. But for your general multicentric lymphoma, we'll use it for people who don't want to be giving injections. It is quite suppressive to the bone marrow, so that's something that we always have to keep in mind, that there is a higher risk of getting infections with this one, and we have to monitor quite closely. So we need to be taking blood tests when we give the medication, but also we need to be taking blood tests when we're sort of at the trough of where the white cell count might be the lowest, courtesy of the damage to the bone marrow. And the bone marrow, where that really comes into it with the treatment is some of these drugs will suppress the bone marrow more than others. And so if we know that we've got good functioning bone marrow, then we know that we can go straight onto these protocols and use them at full strength. If we've got questions about the bone marrow, then we may need to use some drugs that are a little bit more bone marrow sparing. So try to suppress the cancer sufficiently for the bone marrow to recover, so that it's a bit more functional, and then we can start hitting them with the full protocol. So there can be some changes as we go. Now, I guess what we'd call the kind of most basic treatment option for lymphoma is just to use steroids on their own. And steroids can be very, very effective and very well tolerated. They're cheap as chips. I mean, we're talking about cents a day rather than even dollars a day for most animals. It is a short survival time is really the downside of the steroids, in that we really look at about 6 to 8 weeks of median survival time. But for some people, that what they're aiming for is just to be able to spend some time with the dog and say goodbye with it. So the times where we really use that is if the dog had a lot of concurrent issues and they were getting close to thinking, well, it's time to euthanize it anyway. That's where we might say, look, let's put on some steroids. Let's have it feeling good and happy, and take it home, spend some time with it. As soon as it starts to go downhill, then bring it back into us and we'll do what we need to do. The one thing that I always warn people about if they want to go down the path of steroids is it can make other treatments less effective if they change their mind down the track, and we don't fully understand why that happens. But basically, the steroids can induce resistance to chemotherapy drugs in these tumour cells, and so certainly if we're going to be going down the path of more aggressive treatments, I recommend staying away from the steroids initially. But once again, we need to balance out kind of how well the dog is. And if the dog's very unwell and we're waiting on lab samples and things, we're better off to give the dog some steroids, make it well, and actually get it through to being able to start treatment, rather than kind of having it kind of deteriorate while we're waiting on some lab results. So that's really our main treatment options with lymphoma. What we generally look at doing with the CHOP protocol in particular is we look at treating for those 25 weeks, stopping, and then waiting till it comes back. And when the lymphoma comes back, that's when we work out whether we do another protocol or whether we palliate or where we go with it. So what we can do with the CHOP protocol in particular, we stop at 25 weeks, when it comes back, and we do talk about when rather than if, because the chances are it will come back. We talk about whether we start on another CHOP protocol. We have to tweak that slightly as it goes along. And as a general rule, the remission time is going to be half as long for when we start again compared to the initial course. So if the initial course we had remission for 12 months, the second course is probably only going to give us 6 months remission. So it can still be quite effective, and we can still get quite good quality life from the dogs. Or we can look at doing a different protocol. So that's where we might look at introducing some different drugs, because tumour cells can get resistance to these drugs, because what you basically end up with, you wipe out the sensitive cells with the initial treatment, and what gets left behind almost by definition is the cells that are resistant to the drugs. So you quite often have to use something else, and that's where you can look at going on to using your lomustine or some other drugs. But that's something that you sort of discuss at the time. I find most people are happy to do the initial CHOP protocol, have some good quality time with the dog, and then come time to decide whether we do anything more. The majority of people I find switch on to the Prognosis lane just to have that time to say goodbye, and yeah, almost universally people are very grateful for that extra time they get with their dog. Though it is a large cost. We understand that $4.5 to $5 grand is a lot to fork out over the space of 6 months, but for a lot of people to have an extra year and a bit with their dog is well and truly worth it. And like I say, the dogs tolerate it so well. I don't have any ethical concerns when it comes to treating these dogs. That's the bulk of what I wanted to talk through today. Really, what it does come down to is, if you do have a dog with lymphoma, make sure you talk to a vet who's got experience in treating these things, because I think experience does teach, or certainly does teach you a lot about how the animals are going to respond to treatment, what you can do in terms of treating them to keep them healthy, and also just the safe handling of these drugs. They're quite nasty drugs in terms of human health when it comes to administering them. So you really want to make sure that your vet is happy to be handling these drugs. And if they're not happy, there's specialist oncologists. We've got specialist oncologists available in Perth at Perth Vet Specialists, who are very, very good. And so if your vet isn't comfortable dealing with these things, ask for a referral to someone who is, and they can sort of talk you through the process and help things out. And for people from country Western Australia, the other thing that can be available is referral up to Perth to develop the plans, and then treatment can be given locally here. So that can potentially be a good compromise for the more complicated cases in particular. And certainly there are some cases which I feel are, when they're beyond me, I'll look at referring them up to the specialist, because those guys just know a huge amount. And the field of cancer treatment in dogs is moving so fast, it's very, very hard for anyone in general practice to try to keep up. I think that's pretty much got us covered for today. So tomorrow will be Dr. Joe Cockrell will be running the session, and he's going to be talking about dental disease in dogs and why it's so important to look at keeping your dog's teeth healthy, and when we have problems, looking at treating those. So it'll be the same time tomorrow. If you've got any questions, feel free to either post them on our Google Plus site, the YouTube site, or you can email us eatonvet@eatonvets.com.au, and we'll try to answer those questions for you. Thanks. Bye.